right, so now we've made our way through our nasal cavity, right? And then we examined our pharynx in the previous video. And then we arrived at our larynx where our vocal cords are. Here's our thyroid cartilage. Here's our cricoid cartilage. And then here are our tracheal rings. So our trachea comes down, 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 inferior. And then we're going to branch into this side, and then we're going to branch into that side. So this first level of branching that first penetrates this lung is going to be your primary bronchus. So you have a primary bronchus on the right side, a primary bronchus on the left side. And then so you also have to imagine that there are lobes to a lung. And I know it may be difficult to see on this, but when we put it all together, you can see that you have a lobe in each lung. You have one superior, one middle, and one inferior. And so the lobes themselves, the second that we start branching to go into individual lobes, that's when we become a secondary bronchus, okay? And then when we go to the very ends, at the very ends, there's a microscopic image on your lab manual. It looks like this. You have this image, and that's because you encounter this structure at the very ends here, the very tips of this. And so that's what this model is. It's actually a blown up version of what you would see on the microscope. You can see an extensive capillary network where here's our bronchioles. This is where air would travel through, go and then exchange oxygen for CO2 in the bloodstream to do these structures here. Okay, so all of this together, this is called an alveolar sac. And the alveoli are going to be these individual locations where the gas exchange occurs because of all the capillary network that's there. And that's really it. All right. Happy studying.